You know, when it comes to lung cancer, believe it or not, it is the second most diagnosed cancer among men and women and the leading cause of cancer in our country. But we are making great strides, especially when it comes to early detection. And the folks that know all about that are our good friends and the experts, SouthCoast Medical. Joining me right now is radiologist Dr. David Estel. Dr. Estel, thanks so much for joining us here on the Southern Scene.
Thank you, Natalie.
So let's talk about lung cancer for a second. I mean, when you think about it being the leading cause of cancer in the country and the second most diagnosed, I mean, that's an amazing statistic that you guys are seeing.
Oh yes, I mean, lung cancer is the #1 cancer killer in both men and women in the United States. And it's estimated that over 200,000 people will be diagnosed with lung cancer this year. And about 160,000 will die of lung cancer this year.
What are we looking at as far as the survival rate where lung cancer is concerned now?
Well, if you look at all comers for people diagnosed with lung cancer, the numbers are really pretty dismal. The 5-year survival rate is 17%. However, if you find small tumors that haven't invaded surrounding structures like the lining of the lung or major airways and haven't spread through the lymph system or the bloodstream, you have over a 50% chance of 5-year survival. We've known for a long time that CAT scans could detect lung lesions at much smaller sizes than chest x-rays. What we didn't know was if the benefits of lung cancer screening with CAT scanning outweighed the risks of the additional radiation dose of having a CAT scan every year. But that has all changed with the release of the results of the National Lung Screening Trial.
So the lung CT screening that you guys do here at SouthCoast Medical, can you tell me a little bit about that procedure?
Well, the procedure seems like any other CAT scan. You come in, you lay on the table, you get scanned. The nice thing about it is that the newer CAT scanners have very low radiation doses. With this test, you don't need an injection of intravenous contrast, so there are no needles involved, and you just lay on the table, get your scan, and it's over in a matter of minutes. It takes a lot longer to get checked in and change your clothes than it does to have the scan, to be quite honest.
Say, and such an easy procedure, and it could potentially save your life. Who would you say, Dr. Estel, is this screening specifically for?
Well, the screening is specifically for the people that were utilized in the National Lung Screening Trial. And those are people aged 55 to 75 who have a 30-pack year smoking history and are either currently smoking or who have stopped in the past 15 years.
When we're talking about all of these screenings that you offer here at SouthCoast Medical, what I'm hearing is it really is all about early detection. I mean, Dr. Estel, how important is it to have these particular screenings like annually, especially if you are at risk even?
Well, if you look at the differences in lung cancer survival, like I said, if you find a tumor small that hasn't invaded surrounding structures, your 5-year survival is better than 50%. If you have lung cancer that is spread to the lymph nodes, your 5-year survival is probably less than 30%. If it is spread through the bloodstream, it's less than 10%. So the answer in screening is to find it while it's small and hasn't invaded any vital structures.
I have one other question. You know, a lot of times when you see, you know, the scanning equipment and that kind of thing, you know, a lot of people think if they're claustrophobic or you know, they're worried about that. But this is not like an MRI to where it's, you know, a complete tube that you would go in. It's completely open.
Right. As you can see behind us, it's unlike an MRI that's a full tube that you're inside. This is more like a donut where you sort of pass through the donut. So very few people get a claustrophobic feeling with this test.
So that's a good thing. So you're not seeing that kind of, a non-invasive, basically pain-free. It doesn't take much time, and potentially it can save your life. Why is this so important to South Coast Medical here to provide all of these wonderful screenings to patients and consumers, and to really, I think so important when it comes to early detection? Why is it so important to South Coast Medical?
Well, it's so important to South Coast because we care, because we're often the first doctors that the patients see. And if you wait till patients have symptoms from their lung cancer, it's usually too late to save them. So we need to get them in here early, detect them before symptoms ever occur so they can have a good fighting chance.
Thank you so much, Dr. Estel, for joining us on the Southern Scene and educating us so much about lung cancer and the screenings here at South Coast Medical.
It's my pleasure. Thank you, Natalie.
If you'd like more information on South Coast Medical Group, or you have any questions involving the CT screening where lung cancer is concerned, or any of the other screenings, all you have to do is go to the information you see right there on your screen. You'll find out everything you need to know regarding South Coast Medical Group.